Hello, Connecticut, and welcome to the Paid Leave Podcast. The title basically says it all. I'm Nancy Barrow, and I will be delving into this new state program and how it can help you and your family. This podcast will give you information you should know about Connecticut paid leave and maybe just a little bit more. Connecticut paid leave brings peace of mind to your home, family, and workplace. Welcome to the Paid Leave Podcast. June is National Migraine and Headache Awareness Month, and it's aimed at increasing awareness and trying to reduce the stigma. Here to help in this discussion is the founder and director of the Headache Care Center in South Windsor, Gretchen Michaelson. Gretchen is an adult nurse practitioner specializing in headache medicine, and her career has focused on neurological conditions since 2000. She has dedicated her practice to improving quality of life for patients with various headaches, and she is a certified headache specialist through the National Headache Foundation. And Gretchen's practice philosophy centers on providing specialized care for individuals with headache conditions and guiding them towards improved quality of life through evidence-based treatment approaches. And in her spare time, she's a wife and a mom of 6 children. Welcome to the Paid Leave Podcast, Gretchen.
Thank you very much.
So thanks for lending your expertise to this topic in June, especially since it's Migraine and Headache Awareness Month. So have you ever suffered personally from headaches or migraines?
I do not have migraines. It's a question I get from patients all the time. I do have 2 children with migraines, though. So
you do?
I do.
Let's start with the Headache Care Center in South Windsor and how you got started in this line of work with headaches and migraines.
So I've always been in neurology, 25 years now, which is crazy. And I said it was the one field I never wanted to do. I was never going to do neurology.
Why would that be?
You know, it all came down to it just seemed too much, too complicated. I was more into the cardiothoracic world, and that's what I was going to do. But my husband and we were looking to be living in the same location, and the job that made itself self-evident in the ICU was only in neurology. So I thought, I'll just do that for a couple of years, and then I'll transition to what I really want to do. And I fell in love and have never left it.
Wow. And that's amazing. That story is amazing. So tell me about headaches and migraines and how are they different?
You have to think of headache as a description of what's going on. So it's a head pain. So you can have all kinds of different headaches. You can have headaches because you had the flu. You can have a headache because you had hit your head on the cabinet. Or you can have migraine headache, which is an entirely different pathophysiology.
What are some of the treatments? Can they be over the counter like Advil?
They certainly can be. I think for people who have very episodic, infrequent type headaches, that certainly can be helpful. The patients that we're seeing, especially with migraine, we're usually using multiple modalities from prescription medication to neuromodulation to lifestyle modifications and all of those different things combined.
So what's neuromodulation?
So neuromodulation is where we have various types of external stimulus. They have various devices, some that go on your arm, some that actually stick to your head, and that actually try and they all work by different mechanisms, but some of them to stimulate your own neural pathways to try and help control headache or prevent headache. Everyone needs what we call, when we're talking specifically with migraine, everyone needs an abortive plan. This is what you take when you get a headache. But when the headaches become too frequent, it's really not great for the brain. It's an inflammatory process, and there can actually be radiographic changes, like on MRI, that would be related to those inflammatory processes. So when we're seeing patients who are at, 4 headaches a month, 1 a week, we say, at that point in time, we probably should be considering putting on preventative medication.
Let's talk about migraines because they are a different animal. My dad and I both had migraines, and we both had kind of the same thing. We needed dark, we needed quiet, I needed cold, and I think I got my first migraine as a teenager, and my dad was taking Cafragot. And I know it's old school, but he said, take one, and if it doesn't work in 30 minutes, then you take another one. And it really helped. So I think that and I may be wrong, but I thought that we had like a vascular headache, vascular migraines. And I don't know if that's correct, the terminology, but I think it was something, obviously with caffeine helped.
Right. Well, that was something that I think we've made great strides in pathophysiology over the years.
I'm sure.
And so we used to describe them as, and relate pathophysiology more to a vascular problem. Now we've kind of transitioned into a trigeminal vascular situation. So the pathophysiology is a little bit different, and we're not so concerned, I suppose, related to specifically a vascular headache.
Yeah. Well, let's talk about migraines in general. There are obviously a bunch of different types of migraines. Can you kind of talk about the different types of migraines?
Yeah, so we like to categorize migraine. First, migraine, how frequently does it occur? So is the migraine episodic, meaning you're having less than 15 headache days per month, or is it chronic? Are we having more than 15 migraine days per month? And then in addition to that, we separate migraine with aura and migraine without aura. So
what is that?
Yes. So for some individuals, they can have, and again, it's a small percentage of individuals, maybe a third of individuals with migraine that will develop prior to the headache developing, can develop a number of different types of symptoms, whether it be, shapes that move through their field of vision, sparkly lights, zigzags. You can have speech involvement. I know you can certainly watch YouTube videos of seeing people actively in a migraine where their speech becomes garbled. They can have, tingling, sensory type symptoms. And that's what we consider aura, that would and it usually only lasts about 5 to 60 minutes. And then the headache follows.
Wow. So then they suffer from a headache for how long after?
So migraine per diagnostic criteria lasts anywhere between 4 to 72 hours.
What are some of the different treatments that you have for the various migraines?
So I do have to say there have been such great strides in what's available now. So 2018 was a big year in the headache world. We had the addition of various types of treatment options that play with a molecule called CGRP, or calcitonin gene-related peptide, which is a neuropeptide, which during migraine we see those neuropeptides rise, and as the migraine dissipates, we see those dissipate. So we now have targeted treatment that plays with this molecule, and the outcome from using these treatments has just been something we have never seen before.
Wow.
Which is great. We call it like the golden age of migraine treatment. And patients really, truly have been able to be given their lives back.
Do you use alternative kind of therapies like Botox or acupuncture or even like cupping for situations where it can be really severe?
Yeah. So Botox is actually an FDA-approved medication for the treatment of chronic migraine. So that's headaches that are more than 15 days per month. So we wouldn't even consider that like an alternative treatment. That's definitely on label. When we talk about massage or acupuncture, sometimes it depends on what we're targeting. So for some individuals who have a lot of spasticity, that then seems to trigger their headaches, those are patients that I, will send for acupuncture, which can be very helpful for that, minimizing that spasticity.
Yeah, kind of that relief. How much time do people need away from work? Like, it sounds like it's a long process to kind of figure out what they have and what the treatment might be.
Yeah, with migraine, a lot of it is more of episodic, unpredictable times where they may not be able to function. Because again, headaches can last 4 to 72 hours. And I would love to say that we get the first treatment right out of, the gates. But unfortunately, sometimes it's trying of different things to find the right combination so that patient can have success. The gold standard of treatment for us, and I tell this to all of my patients that come to see us, is that you would have complete relief of that migraine within 2 hours, and it doesn't return in 24. So that's what we're striving for. But it may take a couple of, or layering of medications before we find that right fit.
And do you try to find out triggers, and are there always triggers? Because I couldn't figure out what triggered mine.
Right. Triggers they're a hot topic these days because, we have years of talking about triggers and food triggers and alcohol triggers or, dehydration, lack of sleep, too much sleep, all of those overstimulation, all of those different things. I think some of those that trigger, sometimes patients will come in and say, oh, I ate the wrong thing. I had chocolate. And that's what triggered my migraine. And we actually have some more recent data to suggest that actually with migraine, we have activation of the hypothalamus and that actually causes food craving. So you actually might be craving the chocolate, for which then you eat the chocolate and then you blame your migraine on your chocolate when in reality, the pathophysiology was already preceding that.
Well, let's go back and talk about cluster headaches, because I know we had discussed this before, but I know that they affect more men than women.
Correct. So cluster headache is a unique, subset of headache. It's not a huge population in general, but when it occurs, it's profoundly debilitating. So we see it more often in men. These are headaches that last, anywhere from 15 to 90 minutes. We call them a side-locked headache. So they're only ever on the right side of the head or the left side of the head. Tends to feel like it's like a hot poker in their eye. And that pain will last for, again, it's a short duration, 15 to 90 minutes, but they can have up to 8 attacks a day.
Wow. And how long?
Usually a cycle can last 4 to 8, 6 to 8 weeks would be more typical.
And so if you have one of these cluster headaches once, are you more susceptible to getting them?
So men, they usually tend to cycle. Spring and fall is the more typical times that we see cluster. We kind of call it cluster season. And, suddenly your phone starts to ring and, I'm starting back in cycle. Again, thankfully, these headaches, because they're so disabling, we have some great treatments that now are starting to really make a difference for these individuals, because without treatment, there's an extremely high suicide rate with these types of headaches.
Wow, that is frightening. Do you also think about mental health for people who are going through these cluster headaches? Or even someone who's going through migraines? I mean, it is really debilitating when you get like a diagnosis of that and you know that it's a chronic situation for you. Do you suggest that they have like mental health or go talk to someone?
Yeah, mental health is a big part of what we do in neurology anyway, because, there's that comorbid condition between anxiety, depression, and some of these pain conditions, partly because it's unpredictable. So what happens is they don't know when they're going to get a headache, and so they try and plan activities. Then they're not able to participate in those activities, and as time goes on, friends are like, maybe I don't want to invite that person or include them, just because they end up canceling all the time, and then that can send people, kind of down that road. And by the time they come to see us at the headache center, they may have very high frequent headaches and then also be struggling with all kinds of anxiety, depression, that anticipation of when is that next attack going to occur.
Right.
I think that also goes to how important treatment is, because when you have a treatment where you can have complete relief in that 2 hours and it's not going to return in 24, it empowers patients to go, you know what? I have a plan. I know if it occurs, I'm not going to be derailed. I'm going to take whatever my treatment is, and I'll be good to go. And that is so empowering to patients and allows them to feel like they can participate and do things in life, which is why I do what I do.
Yeah, I mean, you want them to be, you want to be successful in the treatment, right? So they can go to work. They can be a mother, father, sister, brother, whatever they're trying to do in life and have some quality of life, because it can be so debilitating. I just know from mine that I've had, they're so debilitating. There's no way I could work through a migraine for me.
Yeah, no, and it would be very difficult if you didn't have the appropriate treatment, which is why we really work through that process to try and get there.
And since 2018, there's these great new meds,
great new treatment options.
That's so amazing.
So we've seen not only better efficacy in treating the actual headache, but also for preventative medication, so that patients now, hey, I used to get 18 a month and now I'm down to 1 or 2 a month, and I take my medication and I'm good to go.
What kind of therapies do you use? Do you use like biofeedback, or do you use different types of therapies for people who have headaches?
So there's all kinds of different things that we use. So obviously medications are a big portion of what we use. Depending on frequency, we have even, IV therapies that we do. We have Botox that we use for those only with chronic migraine. That's the only indication related to migraine with Botox. We have sometimes even just therapy, various types of, cognitive therapy. Some patients use acupuncture, some people use massage. We also talk a lot about lifestyle changes. Migraineurs have very sensitive brains, so we like to keep everything very homeostatic. So everything is the same. So going to bed at the same time, getting up at the same time, which is hard for your adolescents who, they go to school and during the school week, they have to get up at ridiculous times in the morning. And so on the weekend, they're not going to get up at 6 o'clock in the morning. And yet they really shouldn't deviate more than an hour.
Oh my gosh.
From their wake up time. That brain really likes to have everything very much the same. Eating at regular intervals, all of those components will play into headache.
So being a mom and having 2 kids who've had headaches and migraines, How did you look at them differently?
There wasn't a question in terms of diagnosis. And I think that's a big barrier for a lot of individuals. And I think, unfortunately, our medical model right now doesn't play well with that because there's such a limited time. And so you'll have individuals who have seen multiple people before they've come to see a headache specialist and, seen or maybe even not felt like they were heard, that their migraines were as debilitating as they are. And so they say, well, no, I mentioned it to, my doctor or to my specialist. And they were like, oh, if you take over the counter medication and it helps some, okay, that's good enough. And I think then they interpret that to mean I mentioned it, they didn't offer anything else, and so there must not be anything else available. And that's it's just not it's not the case, thankfully, nowadays. But I think it allows people to function at very high levels of headache and potentially miss out on like job promotions and all of those things because then they miss work when there are treatments that are available that really do change lives.
And how young are people that you've treated? Are there really young children that get these?
So at our center, we treat down to the age of 13. But for a lot of women, that time period in their life, hormonal changes that we start to see, that's when those headaches will start to kind of pick up and kind of rear their ugly head. It is a genetic predisposition, so it's not uncommon for us to see the grandmother, the mother, and then the child.
Connecticut Paid Leave, as you know, can help with many aspects of migraines and headaches. You can get up to 12 weeks of income replacement a year to take care of your own serious health condition, like a headache or a migraine, or to take care of a loved one who is suffering from these. And you can take intermittent leave, or you can take a reduced schedule leave, or you can take that whole block leave. Like, say you're really having cluster headaches and you need to take 2 months off to really deal with this, or 3 months off. How valuable are resources like this for your patients?
I think it certainly is a valuable resource that they can have as some income replacement. I think especially that episodic component, because migraine tends to be episodic. So it's not typically that block of time, but to know that they have some time that they can treat and try various treatments so that we can get them to a place where they need to be, with the goal of them being able to say, hey, now I actually am able to use my PTO to do fun things like vacation.
So it is Headache and Migraine Awareness Month. What are you hoping happens during this month?
I'm hoping, number one, that patients realize that having headaches and frequent headaches is not normal. And so if you're having frequent headaches, number one, ask questions, whether it be for your primary care provider or, reach out to us or somebody to say, hey, I'm having these headaches. I'm guessing maybe I should have it looked at, and then have an evaluation. Because I think we normalize, especially with migraine, it's such a high percentage of women that we tend to normalize it and say, oh, this is just how I live. And it just doesn't have to be that way.
And what is the percentage of women that get migraines?
So it's about, across the United States, it's about 20% of individuals can have 15 to 20% of patients. So 1 in 5.
1 in 5 have migraines.
It's grossly underdiagnosed, unfortunately.
And why is that? Is there a stigma still attached to that?
There is a huge stigma associated with it. And actually, there's some newer data coming out now as we're trying to address stigma associated with migraine. And I think it goes back to even, some of those original questions. Is it a headache or migraine? I mean, the reality is that most of us over the course of our lifetime will experience a headache at some point in time. But we have to understand that migraine is a different pathophysiology.
And it can be a chronic health condition, which is another thing that we cover.
Yes, it is a chronic health condition. We say once a migraineur, always a migraineur.
A migraine. Oh, yeah. So that's me right there. What would you like people to take away from this podcast, Gretchen?
Let's see. If I had to choose something, just that there's hope, that there is so many options available. I hear it over and over again from patients, especially in these last couple of years, to say, I have my life back. And I had no idea it would be possible. And I think again, it goes back to combination of stigmatization and not knowing resources were available. So just being able to say, hey, I'm going to look into it and see what I can do, and then be able to enjoy life to the fullest. Now, it's a repeated thing to have patients come back to say, I mean, I hear it all. I get to do more hobbies that I've never been able to do. I've been able to go to my kids' events, for patients to be able to come back and say, I went to my daughter's wedding and I wasn't even concerned about not being able to enjoy it to its fullest. And I think those are those moments that we don't think about sometimes as clinicians, but those are the moments that are important to patients. And to be able to have them come back and really be able to live life, it's great. Or patients coming back and saying, hey, I got a promotion at work because now I'm not, missing all of this work, or not that they're missing work, but they're not functioning to their full capacity because they're trying to struggle through going to work while having a migraine, that they can really advance and do the things that they want to do. And it's exciting to see them come back and be excited about it.
Is that the best part of your job, you think?
For sure. That's the only reason why I stay in it.
With 6 kids, for sure. I want to thank my guest, Gretchen Michaelson, the founder and director of the Headache Care Center in South Windsor, for being on the Paid Leave podcast. Thank you so much for being here.
Thank you so much for having me.
And I got a real education about headaches and migraines, so thank you so much for that.
You're very welcome.
For more information or to apply for benefits, please go to ctpaidleave.org. This has been another edition of the Paid Leave Podcast. Please like and subscribe so you'll be notified about new podcasts that become available. Connecticut Paid Leave is a public act with a personal purpose. I'm Nancy Barrow, and thanks for listening.